But basically, the reason why I do this, that always startles me. I do apologize for the two M4s and the pharmacy students. Y'all may have been through this little exercise with me. So I apologize up front about that. But I don't think the rest of you have. So what I want you to do first is if you basically have a intellectual grasp on what is the components of a general healthy lifestyle. So, thinking about, I guess 6 to 8 hours of sleep per night, generally eating a plant-based diet, what is like 100 minutes of physical activity per week. If you basically have a pretty decent grasp of what those elements are to a healthy lifestyle, if you would please just proudly use your reaction to put your hand up so we can all marvel at how smart we all are at knowing how to be healthy. So I'm seeing some hands. Okay, gotcha. Okay. And then so what I'm wondering is, I'm seeing some hands up. I'm wondering, those of you with your hands up, how many of you basically stick to that? Meaning, not only do you know what to do, but you actually carry that out in your lifestyle as well. That you basically do what you know. How many of y'all would raise your hand if you're pretty much on point with taking care of yourselves? Okay, so there's I have to give y'all credit. There's pretty good numbers here. Better than I would have suspected. So first of all, we have to give a big affirmation to, I think, Erica and Anju, I think, and Patricia. So not only do we want to affirm y'all for doing what is really hard of maintaining a healthy lifestyle, but maybe you could teach us ultimately how you do that. I think like one thing to consider with this is a lot of times we are not doing what we know to do, right? And certainly many times our patients know things that are not healthy, yet they're doing them. So like just taking a moment, what do you think that is? Like, how come do you think it is that people know things to do that are healthy, but don't do them? What do you think explains that? Anybody?
People say lack of time.
Yeah, for sure. Right. So, like I work at a place called the Centers. A lot of our clients live in poverty. They take multiple buses to get to anywhere. So, and oftentimes they're not only taking care of elderly parents, they're taking care of children. Um, it could take them an hour and a half just to do grocery shopping, right? They could have legitimate reasons why time is, I don't have the time to do that. I'm looking at a lot of professionals on here who could maybe make that same argument, right? Basically, I only have so much time in a day. I have to prioritize what I get done, and getting in 100 minutes of exercise a week just may not be on the plate. Yeah, for sure. So time could be an issue. Any other things that y'all think like kind of explain that discrepancy between people knowing things but not doing what they know?
People think they may need a lot of resources
Yeah,
to accomplish the tasks.
sure. And sometimes people might. I mean, it can be really easy maybe for some of us to say, oh, you should get outside and take a nice walk in your neighborhood. Some people, their neighborhood is dangerous and that they may literally not have the resources to do what might seem kind of easy to do. And certainly we all know that some people have different degrees of access to healthy foods, right? And even certain types of medical care. So yeah, there's resource issues too. And I think like my kind of like why I like to start with this is I think that it's important to recognize that a lot of times people need more than education. And a lot of times they've heard, I think, at this point, I've been a clinician for 25 years. I don't think I know anybody anymore who hasn't heard using heroin's bad for them or getting blackout drunk is unhealthy. I don't think I've met anybody in years who has not heard that. No, they may not believe it. That's a different story, but they've heard it at least. Which is why we're going to talk about motivation today, which I think is that issue, right? Is that's the gap between doing what you know. So let me try and share my screen. Okay. All right. And so like one way I like to think about or not just me, like people who study motivation, which obviously it's a philosophical construct. You can't exactly measure it or put it in a vessel or anything like that. So it's sort of a philosophical debate about whether motivation in fact exists, and if so, what is it? But many people who study motivation, and certainly in line with motivational interviewing, there's this idea that motivation is comprised of confidence and importance. And I really like to stress this because if you're trying to encourage somebody to do something or motivate someone to do something, it can be really important, and I may say necessary, to know where it is that they're stuck. So I do private practice. I mentioned I was working with a 17-year-old last night who uses significant amounts of cannabis edibles every day, before school, during school, after school. So cannabis edibles, and I'm talking to her about it. So like one thing she talked about was not having confidence that she could go without marijuana edibles. She believed it helped with anxiety. She believed it was a big part of her friend group. She thought her sleep would be awful. She had tried to stop taking the edible cannabis before. She basically didn't have confidence that she could stop. In the same way, at this point in time, she didn't see it as an important issue either. She didn't think that it really had much of it. We were talking about basically a sexual assault that she experienced, was why she was coming to counseling. She didn't think it was important. At this point in time, she wasn't seeing very many negative benefits, a little bit about how much it costs, but she didn't really see it as an important issue. And another example to kind of think about with this is like smoking. So you're going to have a group of people who are going to tell you, I've tried smoking 1,500 times. I know it's killing me. It's awful. I just can't stop. They don't need to learn more about how smoking's hurting them. They know it's important to stop. What they're telling you is that they're not confident they can stop. Versus that's very different than the person who walks into your office and says, Doc or whoever, I can stop smoking whenever I want to. I just don't want to. I don't see a benefit to it. I like it. It relaxes me. Everybody in my family smokes. They're 115 years old, all of them. None of them ever had any health issues. I don't see smoking as a big deal to me. And so that's a person who, like, they have low importance. They don't see the reason for doing it, but they're confident they could stop. So I think, when you're thinking about people and their behaviors, be it dieting, be it exercise, be it taking medications, and they're just ambivalent about making the change or seeming reluctant or unwilling to make the change, I think it can be helpful to step back and wonder, is it because they're not confident they can change? Is it because they don't think it's important to change? Is it a combination of both? Because our interventions are going to be somewhat different based on kind of what category we put them in. So just to kind of back up for a minute, motivational interviewing is evidence-based. There's been, at this point, hundreds and hundreds of randomized clinical trials, really across the world, that suggest that motivational interviewing, generally speaking, is more effective than the typical advice giving, education, recommendations. That means, yes, you do a course, give education, but there's a way you do that within motivational interviewing, which is a little different than the norm. But in general, it's shown to be more effective. And really the biggest influence on the effectiveness of motivational interviewing is how good the practitioner is. When people are very good at motivational interviewing, and there's ways of testing that, their outcomes are pretty much consistently better than the treatment as usual. It can be done very briefly. I have sessions with people that are everywhere from 10 or 15 minutes to an hour. I know for some of you who are physicians or nurse practitioners, your time can be very limited. Motivational interviewing might just mean you're asking a question or two differently, or you're maybe giving advice in a different way than you would. It doesn't have to be this whole counseling thing. It can be a couple of little sentences you throw in there. It's been shown to be applicable across a wide range of problem areas. So literally everything from flossing teeth to people with schizophrenia exercising more, to people abstaining from tobacco and drugs and increasing physical activity, all kinds of different things. And it's learnable by a broad range of helpers. And this is, I work at the centers is a federal qualified health center, and we have primary care, dental, behavioral health. And it's really cool because motivational interviewing is one of the only interventions that we can all do. And we can all train together, and it really increases our cohesion. And the research suggests that too, that when groups of people who are multidisciplinary learn motivational interviewing together, they report increased team cohesion and less burnout, because essentially you're getting to know more of your colleagues and working with them in a different way. Another way of thinking about motivational interviewing, or another definition, is having conversations so people talk themselves into change based on their own values, interests, and experiences. So I'll give you an example. Like I was actually just doing this training with some of the case managers, and I asked somebody, tell me about a time when you used to exercise regularly. And this person started to say, oh, I felt really good. And I said, well, tell me more about feeling good. And she was like, well, I felt really energetic, and people would comment on how healthy I looked, and I was sleeping better. And I would argue that's probably much more effective than for me to say, hey, if you exercise more, you might sleep better, you might feel better, you might have more energy, because it's the person telling themselves based on their own experience of what happened, than for me to tell them my own interpretation of how exercise might benefit them. And again, it does not mean we don't give advice and education. Of course we do, but you do that in a little different way with MI, which I'll get to. So kind of like the spirit of MI is that you're really focusing on partnership and collaboration with your patient or client. And it's this mindset that, yes, I'm an expert in my discipline, but this person's an expert in their life. They're an expert on what they're willing to do, not willing to do. And therefore, we're coming together to come up with some sort of plan that we can agree upon that can help them be healthier. Another part of the spirit is acceptance, and that's comprised of being empathetic towards people. And if you look at the research on empathy, and that includes for physicians, nurse practitioners, lots of folks, but empathy is one of the more powerful things that we can do in terms of building a helping relationship. And people really do want to be understood and heard by their provider. But it's something we oftentimes dismiss the importance of. And you're going to see some examples coming up. Nowhere in the definitions of empathy does it mean agreeing, which means sometimes we might express empathy towards someone about their point of view that might be very incongruent with what we know to be true, or even what the science suggests. And again, it does not mean we wouldn't bring up that discrepancy in an MI way. But when you're expressing empathy, that does not mean you're agreeing or you need to agree. It means you're expressing you understand that person's perspective. Absolute worth is basically just seeing the good in all people, right? We all have like certain types of clients or patients that probably rub us the wrong way. If we're human beings, we probably have those people. And it's just acknowledging that I need to get over myself and see the good in this person, and that everybody has points of their character that are very effective and things they've worked through. Autonomy support is basically just recognizing that we do not have control over people, nor should we, and we don't. And it's things like saying, okay, I know we've been talking about you taking this medication for the past few minutes. What are you ultimately going to do? And it's about like putting it in their hands. I know some of you are buprenorphine providers. So sometimes there might be stipulations on terms of what your treatment agreement looks like. You can do autonomy support with that too. Say, hey, well, you know what our treatment agreement says, and it sounds like you're not really wanting to stick with that treatment agreement, and that could lead you to not be in treatment anymore. What do you think about that? Right? Like it ultimately still it's their decision whether to comply with that treatment agreement and continue to work with you. So it's just making that very overt that the person ultimately has control over that. And affirmations is basically acknowledging the strengths and the qualities and the benefits of people. And that's, I mentioned at the beginning, people who study motivation believe it's comprised of importance and confidence. Affirmations is what can help people feel like they're more capable. And it is what can perhaps help people feel more confident to make changes. Compassion, that basically means be ethical. We all come from different disciplines, but we all have our ethical guidelines, stick to that. Motivational interviewing has been around for, I guess, around 30 years now, and people have used it for some reasons that were pretty unethical because it is a influential intervention. They've done it to get people into treatment programs they didn't necessarily need, or to participate in research studies that should have been portrayed as more voluntary. So basically, stick to your ethical codes. And evocation is where you're trying to get the person to talk themselves into change, rather than you being the one who's always talking about the change. And you kind of do that through open questions, so things that aren't yes or no. A good example of this was with medications. A lot of times we will ask people, have you been taking your medications? And they will say yes. And what did we learn? Not a whole lot, really. Like, did they taking it every day? Is it helping? Whatever. Versus maybe a question like, what's it been like taking your medications? Or how's it going with your medications? Or what issues you've been having with your medications? And a reason to ask that might be that the research suggests, on average, 50% of the time people are taking medications as prescribed. So knowing that, sometimes you might want to ask a question that allows people to talk more openly about that. Affirmations, we mentioned that, being strength-based towards people. Reflective listening is when you're expressing empathy towards people, and I'll show you an example or two of that. A summary is just a very long reflection. Something like, okay, on the one hand, you don't like taking this antipsychotic medication because you're worried about weight gain, you feel kind of groggy, and some of the people in your family tell you that it's poison. Now, on the other hand, when you've taken it, you've been in the hospital less, the voice is a little bit more quiet, and you feel a little bit more in control. So you kind of like summarize the ambivalence, right? Might be a way that you would do a summary. Informing. So I was mentioning a few times that yes, we educate in MI, but you do it a little bit of a different way. And that would be something like, for example, a client who's, let's say, drinking a lot of alcohol and taking their antidepressant, and they're wondering why they're still depressed. And you might think about something like, hey, would it be okay if I share with you how the alcohol might be affecting your antidepressant? And if the person says, yes, sure, tell me, then you educate them, and then you wonder what they think about it. What do you think about that? How does that maybe fit with you? So in MI, you're generally asking permission before educating, and then wondering what people think about it. It's highly collaborative, and the research suggests that people find that way of getting information more respectful, and they're more likely to listen, because they have in fact given consent to be educated. And I always tell people, patients, aside from the informed consent, I mean, and they still have the right not to listen to that either, they just can't participate in treatment, but people have the right not to be educated. And as providers, we can just document attempted to educate patient refused. But I have to say, I've done that thousands of times at this point in my career, and I've still never had anybody say, no, you can't educate me. And I know it will happen and it will be fine, but it's actually never happened. And following up with, what do you think about what I said, can be really helpful, because you really will get the real understanding of what the person thinks about it, versus them nodding their head at you, which oftentimes people do when they're being educated about something. Developing discrepancy is really helping people see how their goals are perhaps incongruent with what they're doing. So, for example, let's talk about drug use as an example. Hey, I know you've been saving up for a car and you really want to put away about $2,000 to buy this car. How is your use of crack affecting that goal? In a really neutral way, where you're pretty aware, or that, that this behavior might be incongruent with ultimately what they want in their life. Rolling with resistance is essentially when someone has told you, hey, yeah, you've educated me, I hear you, I don't want to change, I still want to keep smoking. That's where you say, okay, I get it. Choice is up to you. What else could we work on, right? It's just the game is up. They're not, you've done due diligence. They don't want to change, acknowledging that. Boosting self-efficacy, we'll get to that in a moment. And expressing empathy, we'll get to that in a moment. So like going back to the initial, like, confidence and importance. So if someone, like, let's just go back to smoking, they're not confident they can stop smoking, and they don't think it's important. So some of the things you're doing in that instance is you're trying to build a relationship with them. You're trying to build an alliance. Chronic issues typically get worse over time. If you have a relationship with that person, you might be there when they hit their quote unquote bottom. That happens with people. Many of us on here have been struggling with things for years. You might be trying to assess their needs, strengths, preferences, values. Collaborate on any healthy behavior change. Okay, so we're not going to talk about smoking. What's something else we could work on related to health? Oh, okay, cool. You want to get more steps in every day. What's a good goal, right? There's no reason why you can't work on one healthy goal while the person's avoiding another healthy goal. Helping people with their basic needs, the psychoeducation thing. So, and the EPE just means elicit, provide, elicit. So again, that's asking permission. Would it be okay if I share with you how maybe your smoking is affecting this other issue that you're concerned about? Like, let's say your sleep and your sleep apnea. Person says yes, you educate them, right? You can do that. And empathize with people, which does not mean agree. So saying something like, okay, at this point in time, that's not important to you. You don't have to agree it's not important. They're telling you it's not important. You're empathizing. Okay, from your perspective, it's not important to deal with smoking right now. Other things you can do, like here's an example. I'm not getting any co-vaccine. Those make you magnetic. I think we know about where that what happened in Ohio State House. Someone was talking about that. And so this is ways that you reflect back when people are giving you, I don't want to change. Okay, from your perspective, the vaccines are mostly dangerous. Again, that's an empathic statement. You're not agreeing with that person. All you're saying is that this is your perspective. Coming alongside, you mostly see drawbacks to getting the vaccine, emphasizing personal choice. You want to figure out a different way to stay healthy. These are ways that you could interact. And obviously, certainly you might try and educate that person about how they're not magnetic, right? But there are going to be a group of people who are going to say, I don't care, doc. I read it online. It's magnetic. Okay, what are you going to do from there? If you're trying to build a relationship with someone, you might just want to empathize that they see things differently than you do. So what about if they're highly confident, but they don't think it's important to change? Threatening people makes me feel powerful, but I could stop if people knew how to act. This somebody said something to me about that like a couple of weeks ago, which is why I put that in there. If people just knew how to act, this person could get their anger under control. But they're telling you they're confident, but that it's not important because they like the way they feel powerful. So you might kind of look at like, how does the person's behavior? So I'd put religious and drug use. That's not like an example. If they're religious and they endorse religiosity, how does being religious, how does that go with threatening people occasionally? How does seeking employment go with threatening people occasionally? How does maintaining housing go with threatening people occasionally? And you ask those kind of things in a neutral way, not judgmental. So, hey, help me understand from your perspective, how do you think threatening people affects your ability to maintain a job? Not in a snarky way, in a like a neutral, curious manner. So that's kind of some ways to think about developing discrepancy if someone is telling you they're confident to change, but they don't think it's important. And obviously that's where you could do education as well, right? To help people see that something might be important to do. You could also do reflections. Being feared makes you feel safe. You were really confident about making changes. And there's this other thing in MI that sometimes we use these rulers. On a scale from 0 to 10, how important is it for you to stop threatening people? How come you're a 1 and not a 0? So basically, you're asking people a 0 to 10 scale. You're asking them to identify a number in terms of importance or confidence. And then you're wondering, how come they're not a lower number? Because what happens is that elicits whatever part of them wants to change. It draws that out. Sometimes people will give you a 0, and that's fine. You just reflect back, okay, that is just not at all something that you see as important right now. So what about if they're low confidence and high importance? I really need to stop using methamphetamine because I got drug testing with my probation officer that I've never been able to stop. This person, they know it's important. They are lacking confidence to do it. So again, reflections are always something you can do in MI, and the research suggests reflections are quite powerful because it's not expressing empathy. You value your freedom so much that you're willing to try to find a way to stop. So that a reflection, kind of saying it in a different way, what they had said. Open question. Tell me about another time you overcame something that seemed impossible. I like these questions a lot because almost everybody, well, really, I should say everybody has overcome something. But we oftentimes come up across an obstacle we feel powerless to overcome. Sometimes asking people to reflect on a time they were in a similar powerless situation and yet overcame it can be inspiring to them. And I'll just give you an example. Some of y'all know on here, I'm in long-term recovery from drug abuse, also dealt with mental disorders off and on through my life. And also I've had rheumatoid arthritis since I was a little kid. And I remember when I was thinking there's no way I can stop using drugs. And my counselor said, tell me about something else you didn't think you could do and yet overcame. And I went right back to being a 9-year-old kid at Emory Hospital, learning I had rheumatoid arthritis and learning that I needed to do these exercises pretty much most of my life, which even in my drug use, believe it or not, I was still doing. And I inspired myself in that moment with, whoa, I've been doing this a long time. And I started to feel hot. And if you know what that, or for me, that meant, okay, I'm getting energy around this. I do feel like I can do something, but I needed someone to help me make that connection. So here's some other things you can do to help people boost confidence: affirming their strengths and abilities. I use the example, if someone, let's say I was talking about smoking with someone, smoking cessation, and they're like, okay, Nicole, you know what? I agree. I really need to stop smoking. And I think over the next week, what I'm going to do is try and go from a pack to half a pack, right? And then you see them the next week and they're like, man, Nicole, like, it's been rough. I actually smoked a pack and a half this week. I feel so disappointed. You can totally affirm that, right? That person was very honest, and that takes courage to be vulnerable like that. So, like, I would probably in that moment go, whoa, that was really honest. It takes a lot of courage to be honest and vulnerable like that, because that's going to help that person. They don't need to feel all beat up. Yeah, okay, they maybe didn't meet that goal, but wow, look at what they're doing in the moment. So finding opportunities to acknowledge people's strengths in not a phony way, but in like a real concrete way, can help people feel better about themselves. Highlighting their past successes, like what I was just mentioning earlier, tell about a time in your life when you overcame something. Setting small goals. I'm big on this, and especially when it comes to drug use, I like to set goals that involve money. How much are you smoking on? How much weed are you smoking a week? $100. How do you like smoking $100 of weed a week? I really don't like it. I'd rather smoke less. Oh, well, how much would you want to spend smoking weed over the next week? I'd like to go to $80. Cool. I like that for a few reasons. It's, to me, it's concrete. Okay, we have a number that we're looking at, and oftentimes people don't like how much they're spending on drugs. I work with wealthier people as well in private practice. They don't like how much money they're spending on drugs or alcohol either. So sometimes making the money the outcome variable can be also just persuasive in and of itself to people. But the point is, like, setting small goals and then celebrating successes when people reach it. Encourage consideration of role models. There's a lot of research that suggests that we're more likely to think we can do something if we see someone like us doing it. So a lot of times if have someone say, Russell, I just really don't think I can get out of this domestic violence relationship. Like, I'm just so entangled in it, families, money, everything. I may say, hey, I hear that. It seems like almost insurmountable. Do you know anybody you identify with that you've seen get through this and to come on the other side of it? And so I asked the question, anybody you identify with? And then the last one is that relapses are normal. Probably all of us on here have relapsed related to a health behavior. We said we were going to exercise 3 days a week. We're not. We said we were going to eat more plants. We haven't. And it doesn't need to be catastrophized or any of that. It's really, okay, like, what did we learn from that? How were you able to be successful for that week? And where do you want to go from there? And then, if you're blessed enough to have people who are actually high confidence and high importance, so you've been talking with them, and they're like, okay, you know what? It is time for me to address my smoking. In MI, again, you want a little more of the story because you want them to continue to talk themselves into change. So a question like, okay, how come now do you want to stop smoking? There's going to be a story there that person's going to say about themselves that might be persuasive. Affirming, whoa, that's a really great idea. And you told me in the past that worked for you, right? That's a double affirmation. You get 2 points for that one because you're affirming the great idea and you're affirming that they had past successes. And again, in MI, reflection, expressing empathy is always powerful. And the research is really clear in a lot of different ways. Expressing empathy towards people is powerful and it seems to promote change. Keeping your apartment is so important that you're willing to look at smart recovery website. So again, just, like an empathic statement. And lastly, and actually borrowed this from the business world. There's lots of research, and I'm sure probably your employers have you do SMART goals. And anyways, the point being that there's a lot of research to suggest doing a SMART goal with another human being makes it more likely you're going to do what you set out to do. So specific, this person is going to complete one trauma exposure therapy assignment. That's all we're looking at, one assignment. Measurable, you could measure that, right? They could turn in the sheet and you could tally one there. That person thinks it's achievable. They think, yeah, I could do one. I'm not telling you I'm going to do the whole kit and caboodle, and I'm not telling you I'm going to do my whole trauma history, but yeah, I could do one trauma therapy assignment on one particular facet of my trauma. Relevant. They believe that beginning to do some trauma exposure therapy is ultimately going to help their social relationships. They think it's going to help them with their kids. They think it's going to help them with their partner. So it's relevant to them. It makes sense with who they want to be. And it's timed, okay, for the next 7 days. So the next 7 days, you're going to do one assignment. So that's basically kind of the gist. And lastly, here's just my references around that. And that's basically it. So thank you all for hearing me out.